In 1984, a desperate Australian doctor named Barry Marshall did something extraordinary. He drank a broth containing bacteria that he believed caused stomach ulcers, deliberately infecting himself to prove a medical theory that no one would believe. This is the story of how one scientist's bold experiment changed our understanding of a common disease forever. For decades, the medical establishment firmly believed that stomach ulcers were caused by stress, spicy foods, and excess stomach acid. Doctors prescribed antacids, recommended bland diets, and advised patients to reduce stress. These treatments offered temporary relief, but rarely cured the condition, leaving millions suffering from painful, sometimes life-threatening ulcers. In the early 1980s, Barry Marshall and his colleague Robin Warren, a pathologist, observed something unusual while examining stomach biopsies. They discovered a spiral-shaped bacterium living in the stomachs of patients with gastritis and ulcers. They named it Helicobacter pylori, and Marshall hypothesized that this bacterium, not stress or diet, was the true cause of ulcers. When Marshall presented his findings to the medical community, he faced overwhelming skepticism. The idea that bacteria could survive in the highly acidic environment of the stomach seemed impossible to most doctors. The prevailing wisdom was too entrenched, and without definitive proof, Marshall's theory was dismissed as absurd. Frustrated by the rejection and unable to develop an animal model to prove his theory, Marshall made a decision that would change medical history. He prepared a broth containing Helicobacter pylori cultured from a patient's stomach and drank it himself. Within days, he developed symptoms of gastritis, the precursor to ulcers. Endoscopy confirmed inflammation in his stomach and the presence of the bacteria. Marshall had successfully proven that H. pylori could colonize the human stomach and cause disease. He then cured himself with antibiotics, demonstrating that bacterial infections, not lifestyle factors, were the primary cause of peptic ulcers and could be treated effectively with antibiotics. This self-experiment transformed gastroenterology. Doctors began treating ulcers with antibiotics instead of years of acid-suppressing medications. Millions of patients found relief from a condition that had plagued humanity for centuries. In 2005, Marshall and Warren were awarded the Nobel Prize in Medicine for their discovery. Barry Marshall's story reminds us that scientific progress often requires challenging established beliefs. His willingness to put his health at risk to prove his theory exemplifies the dedication that drives medical breakthroughs. Today, because of his courage, we understand that many diseases once attributed to stress or lifestyle may actually have infectious origins, opening new avenues for treatment and prevention.